join my audio. So
All right, beautiful. It's nice to see you. Okay, I have Shanti.
Hi.
Hi, hold on. Go ahead. Or are you still mute? I think you muted yourself. There you go.
All right. Hi, Shanti again from Barbados. Thank you so much, firstly, for the presentation. I found it quite informative and quite reflective of what it is going on here in Barbados as well. I think one of the last points that you made struck me in that it's important, regardless of our orientation and our methodology in practice, to do something that helps the client to get to a space of functionality quickly. I find in terms of our culture in the Caribbean and in Barbados, persons are not very open to perhaps 3 or 4 session intakes. You know, that may be what we're trained to do, spend 3 or 4 hours or over weeks doing the intake session or whatever. Our culture is if you come into the therapy space and after the first session you don't have anything to take away, most of the time persons do not come back. So we have had to kind of amend even the intake sessions and the assessment sessions to make sure they have something to take away in order for them to come back and receive the depth of intervention that they need. But for sure, in this time, I have had to also rework my technique and the things that I do, a lot more solution focused, a lot more brief therapy, to make sure that they are at least getting to a point where they can function. And then if there's need for anything further, then we work on that as time goes by. So I just wanted to highlight that. And again, thank you so much for the presentation.
Thank you. I definitely, thank you for sharing with us what's going on with in Barbados. And I do agree that no matter what happens, I think our duty as a therapist is when somebody comes in to find out what their needs are and bring them specifically into a homeostasis and a balanced position where they can function what's going on. To be honest with you, even though like in United States, there's also this concept of different theoretical bases and brief therapy, even with the concept of insurances is something between 6 session to 12 session. But most of the research shows that about 90% of people who go to therapy, they do a 1 session therapy anyway. And they might come back to you, like even if they really liked you, they might come back in the next level. So they still, a lot of places, they deal with psychotherapy as a medical model, which is you go to a doctor, you have a problem, you want your solution, you want to go home. It's not like I got to come to you for a lifetime, like a psychoanalysis. So even on a normal level, I think this model of a one-time deal or a medical model is still something that people are searching for. And I know the way we learn it is different because we all obviously want to dig in and go and do all of that. But I guess we're here for our clients, so we got to go based on what their needs are. Who would like to speak? You want to raise your hand or raise your virtual hand? Or I can unmute everybody. Sometimes there's a noise pollution when I unmute everybody. Hi, Josephine. You have muted yourself, so you got to unmute yourself if you want to talk.
I had unmuted myself. That was a wonderful presentation. First of all, I'm Josephine from Kenya.
Hi.
Yeah, I'm a practicing psychologist. I see clients in my personal practice for the last 10 years.
Wonderful.
Yeah, so just like you said, I think Shanti also mentioned the same. We have a challenge where you find clients come to us with a mindset, you know, like the way you get a headache and you want to go get some painkillers and you just go home. So in my practice, I've seen patients who come, of course, they come with their caregivers and they're not the ones putting up the bill. So you hear that you can see them for like a session or two and they are done. So I've seen that challenge, especially here in being, we're in a developing, a third world country. And it becomes very difficult, especially for us professionals, to really show them how important it is to walk the journey with them. Yeah. So I don't know if in other countries we have these kind of challenges. Yeah. Otherwise, Daktari, that was a very good presentation. Thank you, thank you, thank you so much.
Thank you, Josephine. Thank you for being with us. And I love to hear from others in what it is that goes into their country. I know in the United States, I've been a therapist for almost 30 years. And in these 30 years, it's been very different, where at the beginning, it was that people will come in because they want to work on themselves. And I think some people come in because of crisis, and some people come in because they really want to work on themselves. So there are two different groups for doing that. And then you have the population, which is not paying out of pocket. So they have a service which is being provided for them. So on those level, you might find, depending on the culture of the family, you might find that they will continue, sessions with you. But people who are paying out of pocket, I also saw that if the fees are lower, they will come in and they pay out of pocket if they have the culture that they could value from you and the space of therapy as if it's a brainstorming concept. Like they have, it's a safe place for them, which they can come every week or every other week and see themselves and be for themselves. And if they have the luxury or the philosophy of doing that, then they will continue. But the percentage are very low. Most of the people still come to therapy as if they, the medical model, they're going to come in with an issue. They want you to give them techniques for that issue, give them something, and they will go away. One thing that I've noticed, and that's why I created also that structured model for the therapy for awareness integration, was people will come in with the symptomology. We would support them, give them some techniques for that symptomology, and then they will come back and they're like, I don't know what else to talk about. Like, I want to come, but I don't even know what else to talk about. And then the therapists, we're trained to kind of like, stay and figure out what they want. And sometimes it's like, okay, I can't figure out what to talk about, so bye-bye. So when I noticed that, well, there's a lot of different pieces which comes from their childhood or the way they relate to other people, I created the structure, which is at the beginning, I share with them, I said, we could, I want to hear you and I want to give you the presenting problem that you're coming in. I want to give you something. But I also want to tell you that when we finish with this presenting problem, there's so many areas of your life, such as your intimate relationship, your relationship with people, friends, family, and career, finances, your childhood issues, you're dealing with your body, your self-image, death, nature, all of that. Those are all there for us to deal with, because if you have the opportunity, the philosophy, the finances, or the know-how to do it, then, this is an opportunity for you to get cleaned inside and really get trained in how to, observe yourself and move. Sometimes I've noticed when there's a path to it, which I offer it to them, they'll continue. They're like, oh, that's exciting. Okay, now I'm going to do that. Because now they have a path that they know what's to do. And the concept of the responsibility is not on the shoulder of the client to come in with the next issue. Because at one point they don't know what their next issue is until the crap really, hits them into their face. Before that, they don't know what the issue is. They can't see in the next level of it. So that, what I've noticed, is helpful. Where at the beginning, even the first session, we let them know that I honor what you're coming, and I know this is important for you, and I want to do that. But after we're finished with this, I just wanted you to know that we have all of these other areas that we could work on. And I do that at the end of the first session, where I give them some things, and then because I've heard and kind of have formulated a little bit in my head about where these things might have come from, like maybe it is different versions of things in their intimate relation, or maybe it's a belief system that came from their childhood. Maybe it was a trauma that they shared about the childhood. So because I get that, a little bit of that in the assessment, at the end of the first session, that's how I would formulate for them, which is, I would love to work with you for a couple of sessions about this. And then anytime you're ready, just letting you know that these are all the other pieces that we can also work whenever you're ready. And I've noticed that sometimes people come in and actually say, okay, I'm ready for the next session now, like the next series. That might help if that works. Anybody wants to share? Raise your hand and unmute yourself, I guess, because most of you, I think you've unmuted yourself. I share your hand sign now. Just hold on. Josephine, did you? Oh, there you are. Go ahead. Go ahead.
Yeah, I truly appreciate this interaction. Now, when I think we are in very different backgrounds in terms of countries, but I think as therapists, as professionals, we all play on the same field, same games. Everything is the same. Okay, so I have cases here of say like right now I'm there's a lot of mental health issues in our country because of the COVID-19, even before. But in this country, therapy has not been fully embraced. And sometimes you find where parents feel that they can be able to help their children. And when they bring their teenagers for therapy, you find that they really want to get involved. Now, I have a case that I'm handling, and I'm seeing this girl tomorrow, 18-year-old. The mother is very busy working in the office, and they're just two. She has two children, this lady. One of the firstborn is already into drugs and alcohol and everything. So that one is a gone case. So she has an 18-year-old who has also started abusing drugs and alcohol. So she did this. Okay, this is how I do it, and I need your advice, Daktari. This is how I do it. Like when I see the children, I always have sessions with the parents or the caregivers so that we can work as a team. We can draw goals on how to be able to help the patient who is a child. So this mother went to the house after I briefed her that, this girl is abusing marijuana, and please, let's work as a team and see how we can be able to help her so that she doesn't take the same route the brother took. So what this lady did, she went and searched the girl's room and found biscuits, the biscuits that are raised with the marijuana.
Yeah.
And now she called me, she was trembling. Of course, she was so down. This is her last born, and she never thought this girl would take the same route like the brother. And I felt a lot of burden. I felt so burdened trying now to manage the mother's emotions. And I'm seeing this girl tomorrow. I don't know how to handle when parents or caregivers search their children's room and they find drugs. How are we supposed to advise them? Because there's a lot of that in this country.
Yeah. Anybody want to share their opinion about this?
Sure, I can I guess provide a little bit of insight.
Please.
So let me see. Is my camera not on? It's so impersonal sometimes you can't see someone.
Yeah, we don't have your we have your picture, but we don't have you live.
Okay.
Maybe there you are.
No? Hi. Okay. So the first thing I think that I wanted to comment on is kind of like the fact that As clinicians, oftentimes we do think and we want to value each one of our professions in the same way. And I think that comes from a place of attempting to not offend other professionals. But I think the first thing that we have to do is clinically, we have to be sound and we have to be cognizant of the fact that we aren't all the same practitioners. So because we're all in the field of psychology and psychotherapy doesn't mean that we're all created equally as far as like what the consumers are getting from us. Um, so that's the first piece. Secondly, the assessment, I think, because someone else talked about the assessment process. I think it was Shanti. So the assessment process with one clinician, let's say they're going to a psychologist assessment should be anywhere between 2 hours to 3 hours, depending on what type of psychometrics interventions they're delivering. But if they're going to a psychotherapist, that's a therapist clinician, and that means that their educational housing is from a therapy platform, then they're going to get something that's more in depth. If they're going to a counselor, they're going to get advisement, typically coping strategies, unless that counselor is also cross-trained on therapeutic interventions. So therapeutic interventions are typically trauma-informed, and go beyond the scope of just exploring issues and advisement. I missed your presentation, so I don't know what you covered already, but I wanted to start off by saying those things because I think it's really important, because if we as clinicians don't recognize our value, what our specialties are supposed to be, we're doing an injustice to the consumer because we can't do proper. And I think it's a lot to do with why some people have dropout rates that are higher than others in this field, because we're not necessarily doing justice to the field that we're in. It's also why a lot of people, when they're deciding to go into this field, it's why they're confused when they're doing their research, because we're not doing a good job at providing insight as to what we're supposed to be doing as professionals. So social workers are sometimes clinicians, sometimes they are clinical social workers, but they're still resource and linkage and connections, right? They're going to go over, of course, they're going to go over what you're going to get from a psychiatrist, psychologist, psychotherapist, because they're the ones that are supposed to advocate for the patient as well. And so when we talk about mental health assessments and we're talking about what they're coming in for, and we're aligning them with certain diagnoses, I think the first thing is, cultural competency. So just because we're from that same culture doesn't mean that they share the same cultural or subcultural values that we share. And we have to be able to let the consumers give us what they're needing in that first. We're supposed to be doing an assessment regardless of what epistemology you may be in, but let them give you what it is that they need. And when you're going through cultural indicators, and if you guys don't have an assessment that includes that, I can send it over for free. But when you're going over those cultural indicators, you're covering things that you need to be addressing as phase of life issues, which brings me to your question. So some things are phase of life issues. And so it's up to us as the professionals in the room to normalize some of those things, but help them move into a place of acceptance and then commitment to do something a little bit different than what they've been doing for their own personal wellness and personal emotional and mental health, so that the behaviors in the system can ripple and change. Obviously, I'm a systemic practitioner, right? So that's how you accomplish the systemic change. So if you change one element of the system, the rest of the system has no choice but to change. It's like a machine. That's what family systems are about. Everybody has an intricate role to play. Even in systems where you have extreme drug usage, right? Those particular people who struggle with whatever addiction they're struggling with, they have a function in the family system. If they stop, talked about, is it Fuan?
Fujan.
Fujan? Okay, so Fujan mentioned earlier her desire to bring people to a homeostatic place. to help them balance out their system. When they come to us, what's happening is something in their system, either their internal system or their externally connected system, is struggling with a homeostatic state of being. And so if we're going to bring them balance, we have to address what things have changed, erupted in your life recently, or precipitating factors that you feel like contribute to this new display of symptoms. And then we're addressing for them not just the symptom management, but response oriented management. So we're talking about, okay, so how did you respond before? What are things you did before to manage anxiety, depression, seeing images in the distance that you were sure other people didn't see, things like that. So we're exploring those things, and we're finding out how these things stop working for them. And then when we're talking about substance use, we know that studies tell us, we all function in a society where social comparison theory is always at play, regardless of which country we're in, because it's the nature of humanity. We're looking at what the next person is doing, and that's what we pretty much evaluate our life on. In places where you see there is heavy-set religion guiding the culture, shaping the people, you see even more deviant behavior, because why? They're being forced by some other sector other than internal system to do a particular thing, to be a particular way, while each person is going through an extenuating growth process, as we continue the life cycle. And so we have to affect the way we're responding to those things that typically exacerbate or, create those symptoms for us. And so when you were talking about feeling sorry for the mom, that transference is normal, because we think to ourselves, like, what would I do if, and so you sit in that space and you explore, like, what exactly are you feeling right now? Ask that question. Where do those feelings come from? What do you feel like those feelings come from? Because the thing is, the more we explore with them what they're feeling, and of course where those feelings are coming from, the more they will see that it's their personal perfection and personal biases that is preventing them from seeing the directionality in which that other person in their system is growing. We have to help them understand homeostasis. We have to help them understand the family system growth process, what the life cycle of families look like. We need to have them understand what it looks like for an individual to achieve their personal autonomy and differentiation from their family of origin. That's our job as clinicians, if we're in that space for healing in that moment. Now, if you're a counselor, because I don't know everybody's, different area, then we're basically giving them interventions that they can use to help them move into a place of acceptance. So radical acceptance coping skills. We can talk to them about that. We can provide them with the manual. We can walk them through it. And eventually, it becomes therapeutic in and of itself, because they're able to notice where their biases are coming from, and they can see it before it comes. And as it comes closer, they can move it to the side and say, no, this is their stuff and this is my stuff. Yes, I'm entitled to my feelings and my opinions about their life, but those particular things, my entitlements, are not supposed to be directly impacting their life, because their part of the system has to be able to function in and of itself. So if I am at the top of the simple machine and their position is somewhere in the middle, I cannot be at the top and still be in the middle at the same time. You understand? So it has to do with understanding what your position in the family system is. So if you want the system to run smoothly, you have to be able to function in your capacity. Allow those people to function in their capacity. And you have to understand what it looks like for a child to go through adolescent egocentrism as they approach early adulthood. You know, from the age of 15 all the way through 19, that phase of life is when you no longer have a place of importance. So a lot of the things that you might get from your child might be half truths, no truths at all, depending on how they learn to value you and your insight in that moment. You're going to see them become who they are becoming, because they're shaping their independent, autonomous personalities at that point. And if they're too dependent on you, then you create space for codependency types of disorders, because that's where that comes from. So hopefully that helps.
Yes, thank you so much. Anyone else that would like to join and have a respond to Josephine? I mean, I have, but I don't want to, I want everybody to have a share. No? All right, I'll share. Josephine, I have a lot of conversations that shows up for me when it comes to young adult using drugs and alcohol, and then what happens in their family system. And Dr. Jefferson said it beautifully, so I'm just gonna kind of like build on some other areas. I think this, sometimes when I give one intervention to the parents to do, it doesn't fit the system that they've already created. So somehow I also try to find out what type of a system they have been using. For example, I look at what does boundary mean in that system. Like sometimes they say, you know, the kid comes in and says, you have no right to go to my room. But if the boundaries are always meshed in that family, then even the conversation of you have no right to go into my room does not make sense anymore. Because if everybody's into each other's system and have been in each other's system for a while, then somehow that becomes part of the system. I think the system gets weird if you're pretending that we have boundaries, but then you cross it. So if I'm pretending that, you know, you have your room and these walls and what happens in that room is yours, and then I come in when you're not there to, you know, sneak in, then that's where it becomes disrespectful. But if the boundary of the household, which some of the family systems have it, which is like, hey, this house is mine because I pay for it, and anything that happens in this house, I am responsible for, and you are underage, so whatever happens to you legally, I'm responsible for, and I'm not going to go through something that you'd think you can do whatever, and I have to pay the price, then I own this whole house, and I can go anywhere I like. So, and I'm not saying that one is better than the other. I'm just saying, what does the system look like? You know, is it an authoritarian system, or is it a loose system? Or is it a system that is really underneath authoritarian but pretends to be a democratic system within that, you know, concept? And is it like one that the father would be the authoritarian, which does everything but frightens people, the kids, and then the mother is the one that kind of like, you know, fixes things? And then now there's the mother who went and found this, but now wants to do something where, you know, she's always been the savior of the kids. Now she's going to be the disciplinarian. So then it becomes a kind of like a betrayal for the kid. So I think knowing what the system looks like would support you in how to give an intervention to the mother. And the other piece is also, for example, I give clients, I see a lot, I'm originally from Iran, but I've done all my practice in the United States. So I also work with a lot of Iranians, and even people call me from Iran or other places. And you can see that, for example, in the United States, I can give an intervention that would work because the society around that family operates in a particular level. So if in the United States, I say, you know, you let your young one know that as long as they're underage and they choose to live in this household, that this household, like any other space, has rules. And the rules of this household is no drug use, which means the parents cannot be using drugs either, because you can't create a rule for the rest of the family and not use it yourself. And if the child says, well, and I've had this, well, teen says, I'm just not going to live here anymore, I'm going to walk out. But I know that if in this country, if the person walks out, you can always have the police bring them back, because that's what the law is. So you can say, you're more than welcome. If you like, you'd live wherever you like. I just want you to know that the law says that under age of 18, you still, you know, they're going to come and take you either to group home or they'll bring you back home, because that's what the law says. So depending on what the laws are and the societies are, I think that the parents will have some notion of how to bring some sanity in this conversation, which sometimes it goes out of reality. Like a child says, I'm just going to go live with a friend. It's up to you, whatever you like. I don't know how long you're going to, you know, the other family is going to keep you on their couch. But I know, for example, in an Iranian community back home, if your neighbor's son says, I want to live, you know, they kick me out and I'm coming to your house, the society will kind of keep you, you know, they won't kick you out. The society, the village will hold you. So then that doesn't work. Does that make sense? So it's or like the society is that if my child goes, I'm living in a neighborhood that immediately a drug dealer will have another soldier and they'll pick him up and take him, and it's worse. So it really also depends on not only the family system, but also the surrounding society, because this child is now, they're not 2, 3, or 4. They're having access to a society that they're getting close. So the knowledge of that is so important when you want to give that concept. So maybe asking the mother, what are their fears? What is it that's going to happen? What if the child goes away? What if they take such a boundary that the child says, I don't want to live here. Screw you, I'm leaving. Which is their worst scenario that they think about. If you access all of those fears so that you know that the intervention that you're giving, and then if the mother does, what kind of consequences does the mother or the whole system of the family has to face? And in that way, then you can adjust how much of the boundaries they can set. I've also worked with mothers that it doesn't matter how many boundaries I show them to do, they'll do it once, but they won't follow through with the boundary. So what's the point of saying one boundary and then on the second level not do it? Or I've watched, you know, for example, the teenager utilizing anger and rage, and this is my house, this is my room, get out of my room. You have no, reason to, you have no way that you don't trust me, and how dare you not trust me? And sometimes it's more like just coming back, well, I don't trust you because you haven't shown me that I could trust you. And trust is something you need to earn. And the child might turn around and say, well, you do it yourself. And yeah, and then you might have to be prepared to come clean with some things that you have and apologize for some things that you have done in order to gain their trust, and then request for them to gain your trust. So there's all of these things that happens where one intervention might depend on all of your assessment of what has happened with them. Usually on where I want to get, like the client is here, where I want to get as a therapist with them as a goal. And then these are all the ways that we go, all the roads that we have to take until then. And I even share that with a client where, what is the ultimate beautiful concept that you want? Because ultimately for me, it might be that I wish that the whole world will be sober, but that might not be the idealistic and realistic concept of that family. So sometimes I've asked, like, what is your ideal situation? If it all worked out, what would it look like? And, the parents might just say to me, like, well, the ideal work would be that they're not addicted, but it's okay that they use sometimes. Okay. So working with the ideal of what the vision of that woman is, because she can only work through her own ideal unless her ideal is unrealistic. And then, you challenge that ideal first so she can come to a realistic sense, and then taking the vision that she has and, putting it in a mark. Like, well, if this is your ideal and this is your goal for your relationship with your son, then what would be the first thing we could do right now? What can you create within a week? What can you create within 2 weeks? And kind of systematize it that way for her, so she knows that this is something she can do. Because sometimes we'll give interventions and they're like, I can't do that. I've even said, like, normal sentences, healthy sentences to people. Can you share with your child like this? Sometimes for example, they'll tell mothers and families that when your child becomes around age 13, buy, and I don't know where you go, in the United States, you could buy from any of the drugstores drug tests. And I suggest buy a drug test, wrap it around for their birthday, and say, put it in and say, this is going to be your best friend for the next 5-6 years that we live together, because I don't want to disrespect you and come and check everything. And I don't want to be disrespectful to you in that way. So therefore, I'm going to offer you this, and know that randomly I will, check with you in what it is. And sometimes it will be that I would like that. And, you may say yes, you may say no, and, we'll work it through. Most of the time when I say this intervention to them, they look at me like, I can't say that. And then we look at, okay, well, what do you do usually? Same thing. I'll just wait until one day he comes home high, and then I'm going to go check. And then when you find, what are you going to say? I don't know. So we go walk through this to find out what is it that they can do as a preventive measure as they're coming home. But if there's something happens, then, how is it in their culture, family culture, to communicate that piece with them, with your child, so that you could have the relationship move forward and not sever. We've also had people, between the father and the mother, or another sibling, which in this case, the older sibling already is addicted, to come in and, play the good cop and bad cop somehow. Like one holds the space as a nurturing, another person becomes the systematic disciplinarian, so that, they have someone they have someone who's holding their hand while they're having someone else, which is the system of the family already as a disciplinarian, holds it, but not into placating it, not into, for example, if a disciplinarian, because sometimes if there's a disciplinarian, the family, and then the other parent advises against it, like, it's okay, I'll hold a secret for you. Like, it's okay if you use, I'll hold a secret, I won't tell your dad what's going on. That becomes really detrimental to the system. But if for example, the mother is holding the child, where I know what's, tell me what's going on, if you need, if you're anxious, if you need something for me to support you in order for us to move forward, while maybe like another person of the system is holding a little bit more of the disciplinarian, where no, there's no way that you could use, and this and that. So that might also shift the powers, if you don't want your child just to kind of like run away or feel betrayed. Addiction is one of and I don't know what resources you guys have, because sometimes we need, like in the United States, I bring other resources in. I'll bring interventionists in. I'll bring, a person who is, who can connect to the young adult or the teenager. For example, if it's a male, we'll bring another male counselor who concentrates only on addiction, and get them connected to the teen, because they have a different bond versus, for example, me as a female, older, they're going to have a transference of a mother to me, so they won't really connect with me. But if I bring a younger male counselor who's more, into addiction, they may connect together and bring them in that section. So, utilize other resources for the kid itself. And I hope that was helpful. Yeah, your voice is open.
Okay, thank you. Thank you so much for Jan. I think I forgot that was quite insightful, right? I forgot to mention that this is it's a very dysfunctional family, because they are separated, the parents are separated, and the mother is with the two children. We had checked the older child into a rehab a couple of months ago. Now, the father is far away in a different city, and what the mother was telling, this lady was telling me yesterday, was the father is watching so that for these kids to lives to get destroyed, so that he can blame the mother, right? So it is very complicated, very, very complicated. The other, as you digest that, when a parent goes into a child's room, like this 18-year-old girl, and finds drugs or alcohol or whatever it is, like in this case, the mother found biscuits that were raised with weed or marijuana. How should they approach it? Should they confront the child, or they should, because like now she's telling me that this girl should come tomorrow, that is now tomorrow, to come and see me for a session. So what is the mother supposed to do? She has gone ahead, she has checked the room, and she has found this. And she is checking after my discussion with her, you know what? This is what we have at hand, and this is what we need to do. We need to work as a team to help this girl. So what she did is she went and searched the room, and she found these drugs. So she was asking me, how should I approach? Should I ask her? What should I do?
I don't see any reason for searching if you're not willing to put it out. What's the point? What's the point of me searching where I'm not willing to, kind of bring it out? And I would shift it from confrontation. I would shift it into inquiry. That now I think the most thing that she would have, the concept of boundary I was saying is, if the girl, if the teen is used to the mother going and cleaning her room, then it's more like, yeah, I was cleaning your room, I was doing all of that, and this is what I came up with. But if that's not a culture in that family, and that room has always been closed off, and suddenly she goes in, then she has to say what it is that she decided, why is it that she decided to go? It could be that I saw some behaviors from you that enticed me because I wanted to know why I was there. I guessed that you might be using drugs, and therefore I decided to go search. That's why I decided to go search. And, this is what I found. So now I'm putting it out there and creating inquiry. What are these? And how come, since when you have, not as an accusation or not as a police interrogation, but really from a curiosity place that I love you and I want your best. And this is, as I'm coming and finding this, it's kind of, I'm inquiring about, share with me what's going on in your life. How long have you been using? How come you've been using? What are your process? What is that your intentionality? And come up with a dialogue that two people can have, so that the mother, instead of being afraid, and I get it that the mother is also projecting a lot on the father, like, oh, the father is standing there waiting for this. So she could be more really just coming from fear, and maybe rightly so, but based on what she's going through. But based on that too, but look at this human being which is in front of you, which is your teenager. They need you, and they don't want to be scolded. They've done something, so it's more like loving. I care for you. However, then as the tough love kind of. I love you. However, these are some of the issues that we need to look at, and it's not okay with me that you're using, and it's not okay with me that you're going to do that. So what can we come together, and how would it be from tomorrow? What are your promises? How can I support you? And if you need something, I can support you to, get a counselor for you, or you can go to therapy. Any way that I can support you, I'll be there for you. But what are your promises to me, and how can we, support each other to pass through this time? Instead of like this confrontation of, what are you doing? How come you're doing this? Da, 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 da. Because that's anybody where you go with that type of a confrontation, they're going to freeze. So you close off the way that you would, connect with them. I think Shanti wants to say something.
Yes, I just wanted to agree in terms of the approach that you're speaking of. I think a lot of it depends on, again, the culture of the family and perhaps the relationship that the mother had with the daughter previously. whether they were able to sit and have conversations together, or whether there was conflict before, whether as you explained, the room was always open, so the mother would be in and out of the room, or whether it was a closed space. All of those things will make a difference in how the conversation is started and how it continues with the daughter. The other thing that came to mind is that sometimes we have clients who, although we point them to particular resources, they still want us to tell them specifically what it is that they are to do. And it takes the responsibility off of them in terms of the decision making, so that they're then able to say, well, this counselor said this to me and I did exactly that and it did not work. And I don't know about your dynamics in your locations, but for sure, in terms of the Barbadian culture, that's something that we have to be really careful about and aware of, because they're generally looking for somebody else to blame. It's more of a blaming culture than I'm taking responsibility for my own actions and my own situation. So we tend to have to try to make sure that we point them towards many options, many resources, as is being said here right now, as opposed to telling them this is what you are to do, because it just shifts the responsibility onto us as opposed to onto them, and that's how they tend to go through life.
Thank you. I think LaQuinda, I think you're muted yourself. If you like to share, because you have put in things on the chat, would you like to just share yourself? Dr. Jefferson?
Myself?
No, Dr. Jefferson.
Oh, okay. Yeah, I was in the process of talking to my daughter. But yeah, but so what I was saying is, why not approach it from, so I do a lot of conflict communication because I'm a marriage and family therapist. So my specialty is trauma, families, couples, individuals, things like that. But so I have, I guess, a complex view on when it comes to situations where, as a parental subsystem, you're not coming from a place of support initially. You're coming from a place of defense, because especially in divorcing families, like you talked about, you see a lot of blame and a lot of placation. You see that because people do not feel comfortable living in and speaking in and walking in their truth just yet, because they always feel like the other person is looking to judge them. So when they're having issues with their kids, the first thing you have to address is the parental subsystem. The second thing you want to address is the individuals as they approach the child, because she's no longer a child, she's a developing young adult. And so understanding how they view their offspring is the first thing. And then when you create space for them to communicate and navigate this, okay, I found this in your room, and I'd like to know more about where how you're developing, what your exposures look like, because these are things that you should be curious about as a parent, but oftentimes we miss the fact that we should be curious about those things because of the reasons I just mentioned before, the divorcing parent situation, feeling like you're going to be ridiculed and judged for supporting them. But you have to do so in a way that you're creating space for safe communication. This is something that I've been dealing with. After I found this, I was just, I was a little bit shaken because I realized that I've been viewing you as your adolescent you, as your child you. And I forgot to take into account that you were growing, shaping, evolving. So now I'm curious about what this means for you. Because at the end of the day, the mom found these things, but it's not a guarantee that it belongs to the child. But what we want to discuss is, where is this taking us? Where is this from? And I'm curious to know more about you and your exposures, because if you're changing, I understand that a lot of people right now are experiencing with drugs and okay. Shanti, I was reading her message, but experimenting with drugs and, recreational substances and things like that for a host of reasons. I want to understand that if your friends, if you are experimenting with it, what do you think it's doing for you? What benefit is it providing for you? But just from a place of curiosity. And as a clinician, you can ask those questions, and oftentimes you'll see that modeling behavior. The parents will now start to approach it. But I always say teach to the parents the intervention of conflict communication, because if you teach them in practice, hey, I want to practice something with you guys. I want you to take the speaker role, you to take the listener role. This is your job, because now we're listening to understand each other and not just simply to respond. So if we're listening to understand, we're not putting people in a place of judgment. We want to know what their plight is. We want to understand their plight so that we can see how it fits into the schematics of this new system, this evolving system, the existing system, and what caused us to unbalance. Right? So it's no fault on anybody. We're just seeking to understand what's going on in the system so that we can move to a place of evolution and have some space to improve our outcomes. And so when you're teaching them that, you're letting them know that the speaker has the floor and the other individual has a job to almost semi-play therapist by way of trying to document in their minds what it is that they're receiving. Because sometimes messages are communicated, but they're not received well by the listener. And so when we do that, we're teaching them that, okay, when you're hearing what they're saying, I want you to be bookmarking what you're hearing, because I need you to give it back to them the way that you receive the message, and they'll either give you confirmation or clarity. After that, we can move to a response. Once you know you've received the message right. So what that looks like is, hey, I want to know, where these drugs come from in your room. I found them in your room while I was cleaning your room the other day. So as the listener, for once in the life of the child, she's only responsible now for letting her mom know that she heard what her mom said as she gave it to her. She's not giving her a response or an answer, right? So what it does is it automatically decreases the amount of defensiveness that the child would have normally. That's what it does subconsciously, because she's now in a different role. She's not in a responding role, just an understanding and interpretive role, right? So she would give the mom back, okay, what I hear you saying is, you think I'm using drugs, right? And so the mom might receive that and say, no, you didn't get that quite right, because what's happening right now? We're decreasing hostility. Already, they don't even know it. It's happening. And so clarity is taking place. And when we clarify the hostile message, it can't ever be received. And so when she says, now, this is what I really meant. What I really meant is, while I was cleaning your room, she goes into an expansive explanation, right? I was cleaning your room, and then I was like, whoa, what's this? I found these, and I was like, oh, that's what this is. And I was just curious where it came from. And then I thought to myself, like, my child is developing into a young adult. Oh, I wonder if she's doing this, or if her friends are doing this, and how she feels about this. What are her insights around this particular area? And so now the child receives it as, okay, what I hear you now saying is that you're just curious about how I'm shaping into a young adult, and you have some concerns, right? And so the mom might say, yeah. At this point, the child is no longer defensive. And so she looks to you as the clinician and say, okay, is it my turn to respond? And you say, yeah, now you're the speaker, mom is the listener. That conversation has now started to take place, and they don't even realize it started to take place. Healing has started to take place, and they don't even realize that this is the onset of healing. And they've walked into a space of not only revealing the layers of insecurity, but also getting to a place of more valuable attachment. So not enmeshment, not rigid boundaries, but creating flexibility and growth for their system. The father looking in now develops more respect for the mother and the daughter's relationship. In turn, he'll develop more respect for his relationship with the mother. That's the interesting thing about doing systemic approaches. But I think that having that opportunity to have the mom and daughter connect on that level will also decrease some of her anxiety around, oh, what am I going to do? Some of the sadness around, I failed as a parent, because she'll start to move into a place of acceptance of the fact that her child is no longer a child. She's an individual, you know, and she's being shaped by her experiences in and outside of the primary family system. And now the mom will be informed as to how that's happening. Does that make sense?
Mm-hmm.
Beautiful. Thank you so much.
No problem.
I hope that this was useful for everyone, and thank you for participating. We've gone about an hour and 40 minutes, so I think that it's we're in a good place to complete. And again, thank you for being here. I'm going to put this on a YouTube, and then I'll put the link on our IWP WhatsApp, so that everybody can utilize what we was said today, even though they were not able to be here. So take good care. Bye-bye.
Bye.
Bye.